Hello, my name is Jennifer Lee. I'm 26 years old and I'm from Camas, South Carolina. I'm currently majoring in radiology at Florence Darlington Tech. There are two main reasons why I chose a major in radiology. One of the reasons being my health history. By that I mean when I was 11 years old, I was diagnosed with scoliosis, which is curvature of the spine. Up until then, I'd been very lucky because I never had to get any x-rays taken because I never broke anything. Having scoliosis caused me to have to go every 1 to 3 months and get x-rays taken for 3 years straight, which was very aggravating. I always was intrigued by watching the big machines. I also enjoyed how the techs interacted with the patients, especially seeing how much of a caring demeanor they had toward the patients, which is another reason why I chose this field of study is because I wanted to be able to help patients. So why should someone become an x-ray tech? Well, healthcare facilities are always looking for x-ray techs. Hospitals hire about 59%, physicians hire about 21%, 8% are hired in medical labs, where only 4% are hired in outpatient facilities. The salary for x-ray tech is pretty good as well, depending on where you live and whether you work in a physician's office or in a hospital. In a hospital, you could look to make around $57,000 a year and $51,000 in a physician's office. The lowest someone can get paid is $38,000 a year in this position, and the highest is $81,000. One of the most important reasons you consider this field is not the money or job outlook, but the joy of helping someone. It may seem like an x-ray tech only takes images, but in reality you're playing a much bigger part because that image you take will help the doctor make a correct diagnosis and help the patients get well. There are a few requirements you need to be a successful x-ray tech, such as education and training. It takes about 2 years of college and clinical training. The more training you have, the more you can further your career and get paid higher. Another requirement is you must have a patient and caring attitude, especially caring for children. They're going to already be scared of the big machines and having to be taken away from their mother. I know I was scared the first time I had to ever get it done, but luckily with this caring as sweet as the techs were, it helped ease my nerves and my mind. You should also be able to follow directions correctly. If you understand what the doctor asks you to x-ray, if you misunderstand what the doctor asks you to x-ray, you may x-ray the right foot instead of the left foot, which can cause the wrong diagnosis, which is a big no-no. So what does the x-ray tech exactly do, you may be wondering? Well, they have to follow directions from a physician. They have to be able to adjust and run the equipment correctly. They also need to make sure the patient is in proper position. If the patient is not in proper position, the doctor may get a wrong reading, which could cause the patient not to be diagnosed correctly. They also need to consider the patient's safety and theirs. They must cover the areas of the patient and that doesn't need to be x-rayed so they don't expose them to harmful rays, which can cause serious damage to their body. The tech also should be donned in the right gear so they aren't exposed to any infection or diseases, and they need to wear a badge to measure the levels of radiation they are exposed to so their body does not have any harm. They're also in charge of keeping records of all the patients. You don't want to mix up the different patients and have the doctor make a mistake. You're basically the orthopedic doctor's right-hand man. There are many career opportunities you can do with a degree in radiology by going up higher in your education and training. You can be a sonographer, which takes images of the body's tissues and organs instead of just bones. You can be a magnetic resonance technologist, which is in charge of operating the magnetic resonance imaging machines. There's also the career option of being a radiation therapist who administers radiation to cancer patients and patients that have other health issues. Or you can be a nuclear medicine technologist who also helps administer radiation to cancer patients. So what do I hope to accomplish? Well, I hope to successfully complete the radiology program and be a top student so I can become an excellent tech and make my parents proud and my other family. I also hope to work at McLeod Hospital. From just the little bit of time I was there doing clinical research tech and seeing the whole environment and the workers, it really made me want to be able to work there because they seem like they really care about the patients and their needs and want to help them feel better. Also, I hope to further my career with a degree in nuclear medicine because I want to one day be able to help patients with cancer, because my cousin, who is 13, just got over having cancer, and seeing that made me really want to get out there and help other patients just like him. And so, yeah, that's why I want to be X-ray tech and why you should consider being an X-ray tech. Thank you.